Welcome, 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 everyone. Thanks, everyone, for coming on this slightly warmer night than the last few nights. We're here today to have a forum of the candidates for public advocate of the City of New York. I'd just like to introduce two of the representatives from the organizations that are co-sponsoring this, and there are two co-sponsors of this. Oh, thank you. I'm Manny Rivera. I'm from GMHC. I'm the chairperson of the Consumer Advisory Board there. I'm also a member of the Board of Directors of the agency. And I'm just here to just welcome everyone and get the proceedings started, all right? I think they should have had you up here, right? We've got things going better. First, I'd like to just say that the place that we're in is a new school, and not just when they say new school, it's just not new in the name. The new school has been out doing some new things within the community, within the educational community, and from this forum has been very involved with community affairs and community events and making sure that information is not just transmitted in classrooms and lectures, but in these types of events and forums. And getting a space within Midtown to have this type of forum where money is not being charged and being able to do it free of cost was a challenge. So the new school stepped up to that as part of their civic engagement and their concern about HIV and AIDS. So with that said, it's really a privilege to introduce the president of the new school, David Van Zandt.
Thank you, Manny, and welcome everyone here tonight. I've seen some new people. I've seen some prior people who've been here enjoying some of our programs. We are really pleased to be able to do this tonight with GMHC. Our Center for New York City Affairs, as Manny mentioned, is very active in a lot of civic areas around the city of New York, and we're very proud of its activity. The university itself is now celebrating, or will be, it's 2019, so we were founded in 1919, our 100-year anniversary. And one of our struggles we have is because we're called the new school, although we're now 100 years old, we have to figure out how to be new every day. And the reality is it's not that hard when you have a university full of very creative people, but more importantly, people who really want to use that creativity and make a difference in the world, becoming engaged. We will, all through this year, celebratory year, be having various events. We will try to celebrate both our past, our current status, but also look to the future, what's going to happen, whether it's in civic affairs, government, higher education, whatever it is. So we hope many of you will come back. Our main Centennial Festival will be on October 1st through 6th, 2019, and we'll have a range of thought-provoking debates, performances, and exhibitions that we hope will spark dialogue and offer new perspectives. Finally, tonight's program is really within our tradition of trying to be a place for public dialogue and public discussion. We like to put on programs in which people can share often conflicting views. We want to be a place of tolerance for opinions that may actually differ from our own. We know these are critical days for our city, but also for our country and actually the entire world. I think it really makes me feel great to see so many people being interested in being involved. We have a lot of candidates up here tonight, almost as many as are running for the Democratic nomination for president. But it is really good to see people engaging now in politics to try to make a difference. So I do have to say, the new school does not endorse any particular candidate for office, but we can certainly be a platform where people have an opportunity to share those perspectives. So I ask you, and I encourage you to listen tonight with sort of the critical thinking, critical eye that has sort of marked the New School through its 100 years. Now let me turn it back over to Manny to go on with tonight's program. Thank you very much all for being here.
GMHC is the oldest HIV and AIDS organization within the world. But we have been lucky, the agency, to have probably the youngest currently CEO of all the HIV/AIDS organizations. And this young man has brought a sense of innovativeness and energy and an excitement and has kind of rejuvenated and re-energized GMHC and brought it to the next level of its commitment to providing high-quality services to not only people living with HIV and AIDS, but also working to ensure that, as best possible, that people do not contract HIV and AIDS and that the prevention programs are cutting edge. So we're really excited to have this young man who has done some exciting work in the fight against HIV and AIDS. And I'd just like to introduce the GMHC CEO, Kelsey Louis.
Thank you, Manny, for that wonderful introduction. I love being called young. I might include that in my official introduction. And Manny, seriously, thank you for your leadership of our Consumer Advisory Board at GMHC and for all of the work that you do to ensure that our clients' voices are heard and are included in the decisions that we make at GMHC. Although that was an amazing introduction, I like to introduce myself because I get another opportunity to say that my name is Kelsey Louis, and I'm the proud CEO of Gay Men's Health Crisis. I'm especially proud tonight because this is GMHC at its best. Along with the New School, we have convened a number of candidates for the office of New York City Public Advocate here, so that members of our community can hear directly from the candidates on issues we care about. I want to thank those community members and GMHC clients for coming, and I want to thank all of the candidates for agreeing to participate. Thank you also to President Van Zandt and everyone at the New School for being terrific partners, as well as hosting tonight's event in this gorgeous auditorium. And of course, thank you to the GMHC staff who helped put this together. GMHC has a proud tradition of working with our elected officials, especially the New York City Public Advocate. And we hope to continue this trend with the next person to hold the office. I know firsthand that our clients can be very persuasive and very persistent. So I predict a very productive working relationship. Now, back to Manny and on with the event.
It's important to point out that these candidates for public advocate have been at several forums throughout when this process first got started, all throughout the city, all different organizations, all different topics. But this has been the first forum that has been specifically set up for HIV and AIDS. So tonight what we would like to do is to have the focus on that topic for the 2 hours, that a little bit less, maybe more, that we're going to be here, and focus on that. And also, to just point out that a lot of times elected officials, people have been in public office or have been active, sometimes get bad raps. They've been around too long, they haven't done this, haven't done that. And sometimes it's justified, but it's important as we have this discussion tonight to take a look at the people who have been in public life and to take a look at some of the things that they may have or may not have done. GMHC doesn't endorse any particular candidate, clearly, but we do sometimes think that people who have been in public life often get bad raps, get lumped in with those politicians or those elected officials, when in fact there are people who have records that have deserve a shot at, or deserve a look at, as they're talking about running for another office. So we hope tonight that that process is also going to take place. And the moderator, and we're going to introduce her in a second, when I was backstage with her, I was really surprised that she had a real understanding that HIV and AIDS is still a problem, and it's still a problem in particular in different parts of the communities in the city. And she's going to talk about that and raise questions about that. But unfortunately, everyone is not as aware as our moderator is about that HIV and how the devastating impact that it's still having on lives and people's lives. So hopefully for those people who are involved in this discussion, who are people living with HIV and AIDS or servicing or just concerned, I think this forum is going to be really helpful in moving that conversation. And to that point, someone who's going to be very helpful to moving that conversation, someone who didn't have to have a black book of briefing about this topic, someone who is herself a celebrity and somebody who can influence opinions around the city. It's really great to have our moderator, Grace Rowe, who is a political reporter from Spectrum News, New York 1.
Thank you, Manny. It's great to be here. I'm Grace Rowe. I'm a political reporter at Spectrum News, New York 1, and also, thank you, also the host of New York 1's podcast, Off Topic on Politics, comes out every Friday for those of you who want to engage even more in local news. So big thank you to GMHC and to the News School for bringing us all together tonight. The public advocate position is a hugely important one within New York City. This person who gets this job is going to be second in line to the mayor. They have a big bully pulpit. They have the ability to put a bullhorn and talk about and advocate for some of the most vulnerable New Yorkers. And we're going to hear from actually only a few of the candidates. There are about 23 who are running for this position. So this is only a fraction of the field here tonight. And we're going to try and move things along so that we hear from everybody and have a substantive discussion. So I'm going to just call out the candidates' names. They're going to be seated in alphabetical order with a brief description, and then we're going to get things underway. So our first candidate is Theo Chino, who is a Bitcoin entrepreneur. Daniel Christmann, a community activist who has promoted his platform through an online radio show. David Eisenbach is a history professor at Columbia University. Rafael Espinal is in the city council. He represents the 37th district, including parts of Cypress Hills, Bushwick, Ocean Hill, Brownsville, and East New York. Nomiki Konst is an investigative journalist, a political activist, and an organizer. Melissa Mark-Viverito is the former Speaker of the New York City Council, and in the City Council represented District 8 in northern Manhattan, including parts of East Harlem and the South Bronx. Jared Rich is an attorney and community activist. Don Smalls is a former Obama and Clinton administration official who is now an attorney at the law firm of Boies, Schiller, and Flexner. Jimana Williams is a New York City councilman from Brooklyn. He represents Flatbush, East Flatbush, Midwood, and Canarsie. And Ben Yee is a community activist. So just some logistics for the candidates. There are a few microphones down there, and we're going to pull them out of their little holder and pass them around. And I think for this first question, we will start with Theo and move on down the line. We want to make sure everyone gets a chance to speak, but also we need to move things along tonight. So I may politely suggest that you wrap things up and pass the microphone over. So as Manny said, GMHC is an organization advocating for people living with HIV and AIDS. And right now in New York City, there are more than 100,000 people who are living with HIV and AIDS. That's about 10% of the total number of people in the United States who have HIV and AIDS. And there have been some positive developments when it comes to the epidemic in New York City. In 2017, new HIV infections were at record low levels. But A disproportionate number of those new cases were men of color, women of color, and trans women. What would you do as public advocate to try and drive the number of new infections in New York City even lower? And Theo, we're going to begin with you.
How much time?
Let's,
One
a
minute?
minute.
Hi, my name is Theo Chino. I'm running for public advocate. And what will I do to lower the number of infection? We need to get more condom out there, more education, and tell people how to have safe sex. On the other side, we need to continue the science, and we need to figure out how to eradicate this disease. I am French, so I remember when the Institut Pasteur discovered AIDS, what it was something that people didn't know. And the other thing is my stepfather, or who I consider my stepfather, who was my mother's girlfriend, died of AIDS. So I remember those two stories vividly, and although I don't have it, I'm not gay, so I don't live with it, but I remember the struggle of what it is to live with AIDS and have no future. And suddenly today you have a future, but you didn't plan for that future because you lived with it every day, what is the next day. So I think seeing that, we need to figure out, and as a public advocate, I will fight for education, and I will also fight to restore some sort of the semblance of that future for the elder people with AIDS. Thank you.
HIV is a real scary thing. Whew. You ever go get tested? It's really scary. And I'm a plumber. I'm not here to say I'm going to have solutions about what we're going to do about HIV and AIDS. But I will say, what's going on now is a lot of good work. PrEP out in the streets. I heard Corey Johnson giving speeches about it. They're putting in a lot of effort, and they're doing a good job. The only place I might step in is if something like PrEP became mandatory. Then I'd be like a little like, oh, maybe we don't want to go that far. But as far as the HIV and AIDS fight, I would never do anything to go against it and only support it because I think it's really important. One of the ways I think we can really do a good job in preventing it, especially in the trans community, is we got to start accepting trans people. It's getting out of control. What happened with the military? We had Kristen Beck, who killed bin Laden, and Chelsea Manning, who these people are modern day war heroes, and they're not allowed to serve in the military. That's crazy. We need to be more accepting because when you're transitioning, you need to land into who you are and have a good job, and we need to respect our sex more. When you sleep with someone unprotected, it needs to be for love. So when we get to the point where we're accepting all these different sexualities, people can love each other and not feel so demonized. So I think we need to just constantly keep up the good work because we are doing good work.
My name is Dr. David Eisenbach. I teach American history, U.S. presidential history, and LGBTQ history at Columbia. My first book, Gay Power: An American Revolution, traced the history of the gay liberation movement through the AIDS crisis, and I did a lot of research and documented the incredible impact that gay men's health crisis did on fighting the AIDS epidemic. So many of the people that I interviewed had lost friends in that crisis. And what we have to remember and how we address it today is that the crisis isn't over. We have gotten a kind of amnesia, all right? And we've kind of turned away from the realities. When we have giveaways of Rivington House, when we have the loss of St. Vincent's, right? These were centers of the fight against AIDS, and they have been given away for real estate. I'm running on the Stop Rebney platform, and I believe that our city needs to stand up to big real estate, including when it comes to the issue of treating those who do have AIDS. We need to prevent it with education, like these gentlemen said, but we have to continue to treat those who have the disease. Thank you.
Thank you, David.
Thank you. I'm going to apologize in advance. I have to leave a little early, but I represent East New York and Brownsville, the communities where a lot of the black and brown folks that you mentioned actually live. And the number one thing we should focus on is continue to break down the stigma of HIV and AIDS, especially in neighborhoods like the one I represent. But once there's that fear that goes away with the fact that you're infected, people will feel more open to getting tested. Number two, we have to make the investments. Our communities suffer from inequities because state and federal and local government did not make the right investments when the time was right. So we have to increase education, make sure the funding is out there so we can get more testing into my communities, and also ensure that they understand the importance of practicing safe sex. And we have to start in our schools as well. Make sure that our students are getting sex education so they can be prepared with the information they need in order to protect themselves in the future. Thank you.
And again, just to reframe the question, or reiterate the question, but what would you do as public advocate to specifically try and lower that number of new infections, get it down even lower?
Good evening, my name is Nomiki Konst. I am a former Bernie Sanders surrogate, and I mention that because for the last 3 years, I've gone around the country advocating for Medicare for all. Since the Affordable Care Act was passed, we have seen a decrease in deaths due to HIV, also in catching HIV early on. The number one thing, the number one policy that will change these numbers at the sharpest rate, as we have seen in the last 10 years, is Medicare for all. Nobody should not be able to afford getting tested. Nobody should not be able to afford care. And furthermore, when we're dealing with a housing crisis, as David brought up, we see too many communities like East New York, which has been rezoned by our council member here, we've seen too many communities around the city where people are being driven out of their homes. The most marginalized members of our communities are being driven out because they can't afford health care, because they can't pay for treatment, because they can't, because unfortunately there's prejudice in our communities with landlords. So I think the role of public advocate is not just to make sure that the city's Medicare for All program is actually going into effect, but also to make sure that landlords aren't discriminating, the police force isn't discriminating, because too many people are being driven out of their own communities and cannot afford to survive. It's bad enough having to deal with a health crisis, but then to add on to it a housing crisis.
Good evening, everybody. Buenas noches. Melissa Mark-Viverito here. You know, what I would do as public advocate is continue to do what I did when I was a council member and when I was speaker, right? One of the virtues of this position is the bully pulpit that it provides, right? And being able to advocate for increased funding for the organizations that are providing such vital services. I was proud that under the leadership when I was speaker and also as council member when I was advocating, that we saw an increase in the amount of money, your taxpayer dollars, that were being invested in organizations that were providing the outreach, the education, the resources, the condoms, the PrEP, all of that stuff that was being aggressively done in communities. We had an initiative called the End the Epidemic Initiative. And we also, because of the advocacy that was done locally, we were able to then see the state also take the lead, right? And do what we needed to do. Still not enough money that is being invested. I'm a type of leader that believes very strongly that we need to facilitate the conversation amongst communities and the leadership within communities to define for us what their priorities are. And then we as leaders have a responsibility, right, to then facilitate the resources, the initiatives, to advocate for the laws that need to be changed, to do that. I don't want and expect people to tell me what to do with my body as a woman, right? I don't want other communities to be, I'm not gonna impose my views, right, or impose what I think. I want to facilitate conversations. That is what we did when I was in the council, where we talked to GMHC and other organizations to figure out what initiatives do you think we should be investing in? Being innovative and creative, looking at things that were being done that would be effective. So the bully pulpit is clearly one of them, to really use your voice to amplify the continued needs that exist, to change laws at the state level. I do believe we need comprehensive sex education. That has to happen, but also the additional resources to the organizations on the ground that are doing the direct work, and that's what I would do as public advocate.
Good evening, everyone. I'm Jared Rich. I'm an attorney from Brooklyn. I'm an independent attorney. I work for myself. As public advocate, we're living in a time, thank God, that we have a lot of medication. People can live with HIV for a long time. And I know people in this room are worried about now aging with HIV and the effects of that. So that's going to be one focus as far as making sure people have the health care that they need as they age. We can't get complacent. That's the real problem here. people can live with HIV. Thank God we have all these drugs. But I fear that the kids are not scared enough to take the precautions that they need to make sure that they're not infected. So we need education, and we need to make sure people are still fearful of an infectious disease. We also need to make sure that the medical care is given and the health care is provided for everyone, that they're not gonna, that they take the proper drugs and they take them properly so that we don't have, so that there's no resistance to, we gotta make sure there's no resistance to the medication so that the strains of HIV that get out there are the least resistant forms. And it's all gonna be about education, folks. As public advocate, you have my commitment that I'm gonna be putting resources into educating folks that we still have an epidemic here, whether or not it's treatable or not. Thank you.
Hi, good evening. I'd like to start off by refuting something that was said earlier. HIV is not something that just affects the LGBT community, and I think that's important to say. I can personally attest to that. My aunt died of HIV when I was a child, and she was heterosexual. But it's important to know that this is a disease that affects all people in many ways, from sexual transmission or drug needles, whatever the case may be. So to answer your question, the mayor just announced an expansion of healthcare, an expansion of use of public hospitals in the city, which is a great, laudable goal. I think we can do a lot in terms of prevention with regular preventative testing. But to specifically respond to your question about what can the public advocate do, I am running on a platform of the public advocate as someone that makes sure that New Yorkers get the government that they deserve and the services that are promised to them. So we had a great speech, state of the city, about how we're going to expand healthcare, but it doesn't mean anything unless it's actually implemented and you see the expansion of care. So I believe as public advocate, that's what I would do as public advocate, is to really take that charge as one of the core issues that I focused on. Healthcare is an issue that I am deeply invested in. I was part of the leadership team in the Obama administration that was responsible for the initial implementation of the Affordable Care Act. And as public advocate, I would work on the implementation of this expansion of care in the city. Thank you.
Good evening. My name is Jimana Williams, Councilman from Brooklyn, and I'm running to be your next public advocate. To answer the question directly, of course, I'm proud to have voted on a budget under the leadership of Speaker Corey Johnson that has widely expanded PrEP and PEP, and we're talking about how to prevent the virus from spreading. I'm looking forward to putting even more funding and advocating for more funding as public advocates in the public advocate's role. There's also a problem with some city workers who cannot afford to get PrEP, and we have to fix that. Hopefully we'll be able to speak about that in another question. But I do want to mention two things that are important. One is we have to notice the inequity of this, and a lot of the crisis of it left because in our less melanated community, it did go down. But like anything else, in our more melanated community, the crisis didn't quite go down as low, and as I mentioned, it's disproportionately affecting. And so we have to be real about that and make sure the crisis level is still talked about, and I want to do that as a public advocate. But secondly, I also want to make sure that we take away the stigma. One, of course, it's not a disease that's just LGBT, but also in our communities, communities I belong to, Caribbean, black and brown communities, there's still a stigma of people coming out. There's still a stigma of people being LGBT, and we have to make sure we take that away, because what is happening is many people are hiding who they are, and that is now causing some of our black and brown sisters to get an increase in the virus. And so we have to do many of these things that also include funding, but changing the culture. And we're moving in such a great direction, but as public advocate, I'm hoping to take it even further, because those things will really, really help us be equitable in what's happening with the virus today.
Hi, my name is Benjamin Yee, and the issue of HIV/AIDS is not one which is merely theoretical to me. I grew up in this neighborhood over on 16th Street, and it was the center of gay culture when I was growing up. And I remember when the AIDS Walk started, and I remember when the AIDS Bike-a-thon existed, and it would end at the end of my block. And I knew many, many people in the LGBTQ community, and I watched many of them pass away from this virus. But as mentioned, the AIDS epidemic doesn't touch only the LGBTQ community. When I went to school, in 5th grade, there was a child who was born with AIDS. He had received it from his mother, and he did not make it past that year. So this is an issue which I find incredibly important. We were supposed to have ended the AIDS epidemic a long time ago. Now, insofar as what a public advocate can do, there are 3 main things, I think, which perpetuate this problem. The first, as mentioned, is stigma. When people are stigmatized, they do not seek care for their problem. They are afraid to get tested. The second is that people do not have health care. And when they don't have health care, even if they got tested, they couldn't receive treatment. And the last is we need to drastically increase knowledge of and the use of PrEP because it is proven to stop the virus in its tracks. Now, there are 3 programs that I'm proposing to run from the Public Advocate's Office which would help address each one of these things. The first is Civics for All. The idea is to go into communities and have liaisons from the Public Advocate's Office give workshops and trainings and knowledge about the civic institutions in our city. That includes community health centers, and it includes teaching the basics of our society, a basics of tolerance, the basics of inclusion, the basics of what makes New York great. I've been teaching civics for over 2 years. I've taught over 4,000 people across the 5 boroughs. Hundreds and hundreds and hundreds of them have gotten involved in their communities to become active members.
Can you wrap it?
All right. That will help deal with the stigma problem. Second, power for communities. And all I'll say there is that it will help incorporate new voices into city planning, which is not something we do, and it's something we need to do if we're going to address any issue and pass new, better programs to help our communities.
Thank you. So for this next question, I think we'll start in the middle. We'll start with Nomiki and come down this way, and then we'll go back to Melissa and work out the other side. But substance abuse is a driver of the HIV/AIDS epidemic, and we know that the opioid epidemic in particular has hit New York City and many cities around the country incredibly hard. We had a record number of people die from drug overdoses in New York City in 2017, and the vast majority of those overdoses were from opioids. We've seen New York City make naloxone overdose rescue kits more available. First responders have been trained and are being trained in how to handle overdoses, how to use naloxone. But again, what more should be done? And specifically, what is your plan, if you have one, as public advocate, to help address the opioid crisis in New York City?
It's a very good question. If we look back at when the AIDS crisis exacerbated in the 80s, it was simultaneously while we were ignoring another drug crisis that our government formed. It was the crack epidemic, and it is completely unfortunate and disgusting that now we are paying attention to the opioid crisis when we didn't pay attention to this other crisis simultaneously. So first off, yes, the opioid crisis is a crisis in this city, and we need to invest more in clinics. Again, Medicare for all in this city, if it actually goes through as planned, and if we pass it nationwide, will increase funding at all levels, from the lowest level with a neighborhood clinic to high care centers. And that is why I truly believe that we need to take care of Medicare for all, because this will deal with the opioid crisis funding. In terms of public advocate, I mean, there's limited power in the public advocate other than being a bully pulpit, but of course we need to make sure that the state fully funds what they've promised when it comes to dealing with the opioid crisis. Governor Cuomo has said that he takes it very seriously upstate. Does he consider it just as serious in New York City in every single neighborhood? I think, what was the last part of the question?
Yeah, if you have a plan or what's, yeah, you addressed it. Thank you.
Thank you.
I'm going to push back on the idea that the opioid crisis shouldn't get the attention or shouldn't have gotten the attention, or how unfair it is that the crack epidemic did not have the same amount of attention as the opioid. I represent East New York and Bushwick, where we see an increased numbers on folks overdosing on opioids. I personally had to deal with this tragedy in my own family when my cousin was addicted to opioids and injecting heroin. The problem I saw as someone who was trying to help him was that there weren't enough inpatient programs here in the city of New York so that families could get the real services and help they need to be able to put their family member in a place where they're going to get the proper treatment. Two, I think that we have to continue the education. It goes back to education, making sure that people understand, what services are available for them, what the harms of the drugs. And three, we have to go to Washington and lobby and push back against any of the elected officials up there who are perpetuating the opioids that are coming into our communities. As public advocate, I would not be afraid of going up to Washington and making that happen. We have to push back on all levels. Thank you. Sorry, I got a little emotional. Sorry.
No, I just want to just pick up on what Rafael was saying about Washington's guilt in this crisis. It was Washington and the FDA that was pushed by Big Pharma, right, to get doctors to start prescribing these and overprescribing these medications to kids. They lowered the age, the acceptable age, before it became a big media storm, right? Washington, the politicians we elected. This is why I'm running, because I'm tired of these politicians selling out, whether it's selling out to Big Pharma or it's selling out to big real estate, but selling us out. And I finally believe that we finally have to have somebody who's willing to stand up and say, enough's enough. Now, I had a student who overdosed a couple of years ago, and at our school, we made it mandatory that every floor had the preventative, the counteraction medication for an opioid overdose. I think that every university, every school should have those medicines on hand to counteract any overdose that might happen. Thank you.
So I guess I was 19 when 9/11 happened. Never really heard about oxys. There was ecstasy, I was on the scene. Never really heard about heroin that much. They talk about pharmaceutical companies and this and that. Come on. Afghanistan was total opiate. Get out of here. If you don't believe that, I can't. Now, if you talk to me and you look at me and you know who I am, you're going to be very surprised I'm going to say this. I just got up here and was bold enough to say, I'll back the AIDS crisis, just never make PrEP mandatory. I don't like the government intruding on us. I don't like prison. I have 5 friends that I grew up playing football with that are dead from heroin. 1,700 people in New York City in 2017 died from heroin, and 83 people died from gun violence in the city. Rikers, it's garbage. I had an ex-girlfriend, I almost married her. She was a heroin addict. It took the whole for her to get off of heroin. I don't want them charged with a crime, but we can't have heroin addicts running around because they're just going to get other people hooked on heroin. And we can't look the other way because they're just going to die or destroy their lives. If somebody has a gun, throw them in jail. It's killing people. 83. Somebody's doing heroin, throw them in the hole. I don't like the hole for anything else except for something like that. You throw them in the hole, you make them think about what they're doing, and you let them come out. You want to be forgiving? Fight marijuana, because they didn't really even make that legal.
Greed is good. Remember that sentence from Wall Street? Greed. Well, the reason we have opioid epidemic today is because some manufacturer decided that greed is good and we need to sell those Oxycontin through doctors. And some doctor in Florida, greed is good, let me sell them. They say safe. Greed is good. No, greed is bad. I'm a French socialist, and I can tell you corporations sometimes, when they're not held accountable, they believe that greed is good. But no, greed is bad. And the reason we have this opioid epidemic is because they kept selling it as saying, oh, we'll get it. And the problem is people taking it and buying it on the dark web and whatever, using Bitcoin actually. They were doing it because there is another problem, which is a mental health problem. Because people would go and self-prescribe the medication because the doctor said, you cannot have it anymore. So they had to self-prescribe. So we have to discuss about the mental health issue. But so you asked me what I would do as a public advocate. Well, there is a little root coming from Africa called ibogaine. According to the science, is that little root takes away all the opioid withdrawal symptom someone has. But the problem, we don't want to study that root. They say it's too toxic, it's too whatever. So me as public advocate, I will lobby that we start looking at to find scientific solution to the opioid crisis. So the first thing to do, someone who has an opioid, take them out from their withdrawal problem and then work on their mental health.
Thank you. We'll do, I was going to say go to Melissa, and then we'll work our way out to the side.
In terms of the role of the public advocate, let me say, when I was I think my last year as speaker, we put funding in to do a study looking at the safe injection sites, which I support. Very controversial, obviously a lot of pushback, but felt that it was needed. Even the administration was not very supportive of it. This is something that we do have to do in the city of New York. There is a commitment, right, to have this happen. Finally, the mayor came along and said that he supports it. The role of a public advocate can be to monitor that process, right? To ensure that it is being done with community input, community feedback, and making sure that we're living up to the principles, right? And the commitment that was made to make this a reality. The other issue here is the issue of, because for many reasons, right? We all know the need, and also with regards to transmission rates, and that's important too in terms of making sure that we're doing and creating spaces where we're dealing with this in a humane way. The other issue is the empathy part, right? There are people that have addiction, and those individuals need special care and services. We have an issue in this city of NIMBYism when it comes to helping out our homeless families, whether it comes to providing services with those who have addiction. Nobody wants these services in their communities. And so that is, to me, unacceptable, right? There is a need, and we have a responsibility as a city to step up to the challenge of the needs that we have in the city. There are families that need help and need that are homeless and need assistance. We have those who are addicted and need support and care, and we have to do it in the most humane way possible. So the issue of monitoring, the implementation, that's something definitely that the public advocate can do. And to build a coalition, you can build coalitions around an agenda, right, that you want to move forward, making sure that you have advocates at the table that can really inform the issue, that give their perspective. We are there, again, as I mentioned before, facilitators, to make sure that the change happens and then we're responsive to all the needs of New Yorkers. And that experience I have as an organizer, I continue to be, and I will bring that to the position of public advocate.
It's a complex issue, opioids, but I want to make a really simple point. We have manufacturers manufacturing this many drugs, and they know it's for this many people. They manufacture this many drugs, and they know it's for this many people, and we're all wondering what's going on. The city charter says this. The city charter says, in addition to the other duties and responsibilities, the public advocate shall act as the public advocate. And what does that mean to me? This is what it means to me. We're going to go after the manufacturers. We're going to go after the pharmacies. We're going to go after the bad doctors that are pumping these drugs into our communities and killing and destroying our communities. Because we all know, once you start with those opioids, there's no coming back with those opioids. Of course, we have to treat people that are addicted. We have to work on not letting anyone touch these opioids. When you go to the hospital and they ask you how your pain is on your head, and you say, I don't know, it's a 1 or a 2, and they ask you if you want morphine, there's a problem there, folks. We have to attack the source. There's a legal drug distribution chain that's going from the manufacturers to the streets. And as public advocate, I'm going to attack it. Thank you.
So I talked a little bit before about my experience at HHS. One of the other things that I worked on while I was at the Department of Health and Human Services was the Mental Health Parity Act. And that act required insurers that provided medical surgical benefits to provide mental health benefits, including addiction services at on parity with the medical surgical benefits. And so when we talk about rising levels of addiction with opioids and other substances, that is something that I'm very proud to have played a critical role in to make sure that those services are available to people as they need them. Specifically with respect to public advocate, I'm not going to repeat what other people have said, but one thing that has not been mentioned is the Fund for Public Advocacy, which is a fund within the Public Advocate's Office that the Public Advocate can raise money to try innovative approaches to some of the city's problems. That's one of the things that I bring to this race, having over 2 decades of experience in law, government, politics, and philanthropy, and having worked at 2 of the largest foundations in the world, the Ford Foundation and the Open Society Foundations, in terms of raising money into the Fund for Public Advocacy to explore new ways to attack the opioid crisis. Thank you.
Again, I just always have to be honest because someone brought up before whether or not, crack cocaine was used by everyone. When it was viewed as our more melanated brothers and sisters, we got names like crack whore and crackheads. And now when an opioid is viewed as Senator Marty Golden, who's a Republican, pointed, not a ghetto drug, but a drug of doctors, they are viewed as people who need assistance and who need help and who have a problem. That second one I always want to make sure is the correct way of viewing this, but we'll be here again, so I hope we remember that people need assistance and help who are in this situation, no matter what the color of their skin is, and we have to be honest when we're talking about that issue. But now when we're there, and this goes back to time immemorial, people and human beings have done things to self-medicate, to alter their mind, to get away from the spaces they're in, and that's human beings. And we have to begin to view people and their humanity. I don't know anyone in this audience what your life's journey was to lead you to where you are now. And my job as public advocate to provide the best assistance that I can, no matter where you are. And so that means, yes, we have to support safe injection sites. We're talking about, if we don't forget, how to prevent the spread of HIVs. And so those safe injection sites will be monitored to make sure that people are not sharing needles, that people are doing it correctly. I was proud a few months ago to be with New Sanctuary Coalition packing safe injection packages for drug users so they can re-clean and use the tools and not harm someone. I believe that to be God's work. And that's the kind of vision that we have to have in the Public Advocate's Office. So whether it's the safe injection sites, whether it is inpatient care, we have to begin and never forget the humanity of wherever we are and whatever station someone is in. And that's the critical importance. And when we do that, we will not only help people who are in need and perhaps change the need that they have at that time for whatever they were trying to change their space and their mental space from, to also preventing the spread of HIV. Thank you.
So we all know there's an incredible crisis with opioid addiction. And instead of waxing poetic about how that is terrible, because we all know it is, I want to talk about what we can do right here in New York City. Not going down to Washington, not even having to go up to Albany. We don't necessarily even need the mayor or the city council to do a bunch of really important things. The first has to do with stigma. So there are 3 main root causes, I think, or there are 3 big problems with the opioid epidemic that we could start addressing immediately. The first is that stigma. People are afraid to come forward because they are addicted to a drug, therefore they do not receive help, they die. Now, part of that, of solving that, is that bully pulpit. It's one of the few things that bully pulpit is good for, moving cultural discussion. Things like safe injection clinics are very important, and they need to be done, but we need to start changing the stigma around the act, because that is why people oppose safe injection sites in their communities. The second thing is dealing with the land use issues, like safe injection sites, and like the fact that our healthcare system is a disaster. We have hospitals closing all over the place. People cannot get the medical care they need when they do not have access to hospitals. And this is something we can solve, and it's something that we need to solve as a community. And so a program, one of the programs I'm proposing, Power for Communities, brings together community stakeholders to do proactive city planning. We don't really have city planning in this city. We have zoning, but zoning is not planning. And we need to bring together stakeholders to talk about how New York should develop so that when we have more people coming to live in our city, we have the attendance services that are required. And when we have challenges facing the city, people are brought together to talk about how we can solve them as a community and therefore place things in our city like safe injection sites, like affordable housing, like homeless shelters, with community buy-in, so that communities don't feel overridden and they have an investment in the outcome. And when you have a plan that everybody's bought into, you put pressure on elected officials because a mayor doesn't want to have to upset every community at once. And certainly not any city council member or politician looking to climb that ladder to run for a higher office. And the last and final thing is the manufacturers. We don't have to go to Washington to change the law per se. Justice for New Yorkers is the third program. It expands litigation focus, and the manufacturers of these pharmaceuticals will be first on the docket.
So Ben, I have a quick follow-up for everybody, but I think you addressed this in your remarks. I wanted to get everyone on the record on supervised injection sites, right? These are places where drug users, heroin users can go to inject drugs using clean supplies. The mayor, as it was mentioned earlier, has backed a plan for a one-year pilot program within New York City that would open 4 of these supervised injection sites. It hasn't happened yet. It's sort of waiting on Albany approval, but I just wanted to go down the row and make sure. I know Jumaane Williams said he supports them. Melissa Mark-Viverito says she supports them. Ben, it sounded like you're also in support.
Yes, programs like that will help alleviate the spread of disease and also with our drug problem. The most important thing, though, is to understand that it should be done and must be done with community input so that wraparound services are provided wherever they are and there is community buy-in.
Theo?
Well, the great thing about being a French socialist is we kind of put it together at a certain point. So yes, absolutely, and they work.
I do not support them. I wouldn't say no injection sites. They might work. However, heroin is a real crisis, and I stand by as soon as somebody's using, get them in solitary quick. Not crazy solitary, but get them off heroin quick.
Yes, I do support them. I think that there is going to be a lot of fear and concern, and we should respect that, but we should counter that with facts. And the experience that has been had in places that do have safe injection sites, the job of the public advocate should be making sure that the public is aware of the facts and why we need these sites.
Yes, I'm supportive.
Yes, I'm supportive of safe injection sites, and just one thing to add to this, I believe that legalizing marijuana will also help with this problem.
I'm in support of the safe injection sites, but we have to make sure we don't just give up here. We got to make sure we're maintaining a focus that we're trying to attack the opioid epidemic so we don't have people seeking safe injection sites. You know, of course, I believe every single person deserves to be treated with basic human dignity, and that includes everybody, includes drug users or drug non-users. So we're going to treat them with dignity, but we need to make sure we're attacking the actual epidemic.
I support a pilot program to get more information about the efficacy of these sites.
Yes, like I said yes, I do agree that one of the issues with the administration is that often doing things to the community, not with the community, so there has to be a community discussion, that's 100%, and I'm just proud, a few years ago, 6-7 years ago when I came to the council, I was crazy Jimani. Now most of the things people thought I was crazy about, whether it was injection sites or legalization of marijuana, is now mainstream. So I'm just proud to have been part of that crew that helped make this things that people are talking about.
And just to be clear, to clarify, there was money and there was a study that was done by the Department of Health that we funded at the City Council. So it has been studied, it has been analyzed, it has worked successfully in other areas. The United States always seems to fall behind, but we need to get to implement these as has been directed and studied already.
Thank you all. So in talking with people from GMHC before tonight, this phrase was raised in conversation, the idea that housing equals healthcare, the idea that people who have good, stable housing take better care of themselves, and that it's integral to their own health, mental health, and physical health. In recent years, as we all are aware, we have seen record levels of homelessness in New York City. In November of 2018, there were more than 63,000 homeless people, including 23,000 homeless children sleeping each night in the city shelter system. What, as public advocate, would you do to help the homeless problem? And do you have a specific plan to address it as public advocate? And we'll start at the far end and come back this way. Sure, yeah, we'll start with Ben.
Great. So homelessness is obviously a tremendous issue in this city. And you also touched on the idea of healthcare as well. So these are two of the biggest challenges facing our population today. So first, I just want to go on record as saying, yes, housing is intrinsically related to healthcare. You cannot be healthy if you don't have a place to live, if you don't have hot water, if you don't have heat, and if you don't have a roof over your head. This is why NYCHA is such an incredible disaster. But that being said, I will now go into the additional points of the question, which is what should we do about the homelessness crisis? So there are several things that need to be done. The first is we need more funding for homeless assistance, and we need more funding for programs that help provide shelter and food and all of the other attendant needs that humans have. But as public advocate, you don't necessarily have the budget to do that, and you're not the mayor, and you're not the city council. So what I think really needs to be done from the public advocate's office is, again, a program like Power for Communities, which will allow communities to come together and develop proactive visioning plans for the city. Working groups that engage stakeholders so that they can start talking on day one about how the city should develop and who should. All right, you can all laugh. All right, get it out. All right. And where the things that we need in the city should be placed. The problem with the homeless crisis is not just one of homelessness, it's one of recalcitrance on behalf of our government to engage effectively with communities to solve the problem. And we need to do that. So by properly engaging communities, we can figure out what concessions and what wraparound services need to be provided so that communities are happy to accept them, and what other programs could be exchanged in return. And if we do this, we can have community buy-in to solving the homelessness issue. And if we do that, we can actually have effective programs. So that is what I would do.
Thank you, Ben. We'll go, down the line. You can be next, Jimana.
Thank you. I can't answer this question in a minute. I'll try. I'm a tenant organizer.
You do want to. We're then going to turn it out to the audience for some questions. So.
Okay. I'm a tenant organizer by training. This is what I've been doing 20 years. Before Barack Obama, nobody knew what it was. My mother thought I'd never make a living. She wanted me to get a real job. But I will say housing is critical. The answer to homelessness is housing, just for definition. Well, unfortunately, we have two plans. We have a housing plan, we have a homelessness plan. We have two deputy mayors, we have two commissioners. There should be one plan for housing and homelessness. So that's the first thing. Whether it's rent regulations that's coming up, whether it's me calling for a moratorium on most rezonings in the city until we repeal and undo the failed mandatory inclusionary housing zoning, which I voted against last term, but we didn't have what we needed to fight back against the mayor at that moment in time. Whether it is the legislation that I passed to deal with three-quarter abuse, because so many people on three-quarter housing have HIV and AIDS. I can do that as public advocate, continue to put legislation. Whether it was funding for HASA that it was being taken out, whether it was working with Vocal, whether it was being on the first vacancy count of the city of New York when I ran Tenants and Neighbors. Those are all the things that I did leading up to here. As public advocate, I want to continue that trajectory because housing is a right. It is not something that's an aside. There can be no healthy communities until people have deeply income-targeted affordable housing. Not just affordable housing, because something's affordable to everyone, but income-targeted. Now, and if you're homeless or you have HIV and AIDS, there is a stigma. That housing is critical for your health. And this city right now is failing. I forgot to mention NYCHA, which is critically important, being run by two men who worked for HUD and are now doing a male measuring contest with 400,000 lives. So those are some of the things that I have done. As public advocate, I want to continue that with the powers that we have to introduce legislation and as the bully pulpit.
So there was a part of your question that specifically focused on children, and so I'd like to start there. There are 63,000 homeless families that are in shelters every night, but there are more children that are 6 and under that are homeless than there are single men. That is something that resonates with me on a very personal basis as a mother of 3 very small children, 3, 5, and 7. My position on that is we need to get these young women and these young families out of the shelters as soon as possible and into stable housing. Right now, there is no preference for women and young families with young children in the affordable housing lottery. So that's first and foremost. I can't make that happen alone, but that is definitely something I would advocate for as public advocate. I also think within that population of the homeless population is a large population of LGBT youth, and I think that's important to mention as well. We need to increase shelters that specifically focus on the population and their needs, which expand beyond just giving them a place for the night. Thank you.
When I was in college in Maryland, I did something for extra credit. It was offered by the National Coalition for the Homeless. It's a program called the Urban Plunge. And we actually lived as homeless people in Washington, D.C. for the weekend, and you learn a lot. You learn that the food is really not the biggest issue. There's a lot of food, there's a lot of food banks, there's a lot of food trucks. The issue is this. When you live on the street for 2-3 days, you start feeling in your brain something snapping. When you live on the street for 7 days, something snaps in your brain. You're an outcast from society, and something changes in your brain. And if we're not going to have the mental health care professionals reacclimating people back into society, it's a lost cause. That's one thing. We're going to focus on mental health care. Second thing, the city of New York is paying for something like 11,000 hotel rooms for homeless people. We're not paying, we don't get a bulk rate discount. Somehow we're getting a bulk rate increase. We're paying double the rate for 11,000 hotel rooms as temporary housing rather than taking that money and building housing. That's what we're going to do.
It's a lot to cover in 1 minute. Look, I think first and foremost, I've talked a lot about public housing, so we need to have a really aggressive plan on the preservation of those units and bringing those units up into habitable conditions, right, and improving the quality of life of the residents or neighbors that live in public housing. So that's something that definitely has to be focused on and a priority that we could use the bully pulpit again to build a coalition around that issue. We have to make sure that with this majority now in the Senate, that we do change our rent regulation laws, right, and to the interest and benefit of tenants. We have to be much more aggressive about the enforcement to go after landlords, right, that are deregulating units, because that is something that we're seeing is not happening aggressively enough. There's people that are being forced out of their apartments, and there are units that are being deregulated illegally. Deeper, more aggressive enforcement. I was proud that under my speakership, we were able to pass the legislation that ensured and assures that every tenant has a lawyer when they go to housing court. That has been really, really critical in maintaining people in their homes and has helped drive down eviction rates. So that's something that has to be invested in. And the last thing I'll say is that we also have to invest more aggressively in affordable housing, income-targeted housing, so that we can get deeper into the levels of affordability. That when we do create units and get units online, that we're setting aside a larger percentage of those units for homeless families in particular. Those are some of the things that can be done, and again, that is something that the public advocate can monitor and can weigh in, and making sure that the city is going in the right direction. Many other ideas, many other issues, but those are some in a nutshell.
I have to correct you, I'm so sorry. But most working people, or most homeless people are working people. Yes, we have a mental health issue in this country, and yes, nobody should lose their home because they don't have access to health care, and nobody should lose access to health care because they lose their home. We have a housing crisis in the city. We generate more wealth in the city than anywhere else on the planet, yet it is more unaffordable to live here than any other city in the country, with the highest rate of income inequality. And I think a lot of it lies in one place: the real estate developers who have been getting off tax-free for the most part. They've been deregulated since the mid-'70s, and they've bought off our state lawmakers. We had 8 senators who were conferencing with Republicans, holding up rent control and rent stabilization legislation in Albany, and we've got a city council and a mayor who've been bought up by these developers. It's not enough to be progressive on 90% of the issues. It's that 10% of the issues that determines whether somebody has been illegally evicted from the neighborhood that they grew up in. It determines whether or not a council member sides with rezoning their neighborhood. It determines whether or not these oligarchs who are buying up our apartments around the city are paying taxes or not. Why is it we're able to give them tax breaks, but we don't have the money to build affordable housing? We are in crisis. We need to take this seriously. And as public advocate, I am not only not taking any form of developer money, whether through loopholes or not, but I am taking them on directly, investigating them, and I'm investigating city agencies, or like the MTA, where we have a real estate developer sitting on the MTA, or NYCHA that's having closed-door meetings because they're owned by developers. We have to start understanding that these two work hand in hand. The developers in the city are making our city inequitable, and they're driving out all from middle class, higher middle class, to low income in this city, making it completely unaffordable.
A lot has been touched on, and I agree with a lot of what has been said. I think what we need to do is, first and foremost, as rent laws are being talked about in Albany, we have to push for universal rent control. That is the only way we're going to start a conversation that's really going to protect people from the rising rents across the entire city. 2, we have to stop building homeless shelters and start building permanent homes for those folks that need those homes. And we have to make sure that when the affordable housing is being built, that we have a strong set-aside for homeless families. Right now, there's a bill in the city council that's pushing for 20% of set-aside strictly for homeless families. The administration does not agree with the bill, but I'm a co-sponsor, and I'm fighting with the prime sponsor to make that happen. That's what we need to do, and as public advocate, I'll continue doing that as well.
Thank you.
You know, it's not a coincidence that we have record homelessness and record displacement under a mayor who, while he promises to provide affordable housing, is out to rezone mainly neighborhoods of color with the support and buy-in of members of the city council, many of which are my opponents. Now, we have a lot of Democrats, right, who suddenly are against Bill de Blasio, but where were they in 2017 when I ran for public advocate? And I said Bill de Blasio has sold out this city, that these rezonings are causing the homelessness and the displacement, that Bill de Blasio is working with REBNY, the Real Estate Board of New York, on a displacement and replacement agenda. It didn't just start with Amazon. It goes back to East Harlem. It goes back to the rezoning of Inwood. It goes back to East New York, Jerome Avenue. And if you keep on electing the electeds, they will keep on doing big real estate's bidding. So I ask you, please consider an alternative, because New York is going down the wrong track. We cannot have a sustainable economy and a sustainable city if it is just for the haves and the rest of us just scrambling to get by. Thank you very much, David Eisenbach.
First of all, what do they call this? The bully pulpit? This guy, head of housing and buildings. This woman rezoned Harlem and the Bronx, and everyone's mad at her. I should have looked into you. I haven't. This guy right here has the backing of the Williamsburg developers. And these two right here haven't been talking about East Side Access, which is a subway station, a train station that's going right into Grand Central Terminal. Amazon has it right out of the backyard through Sunnyside Yards, and a commercial train, 8 years in the making, $13.5 billion. But what that's gonna do is that's gonna send an express rail straight out to Jamaica and a one-stop stop to East New York. The communities that this guy and this guy are advocating for, they actually aren't. And what's happening is the developers are backing him, and he's head of housing while we're in the middle of a NYCHA crisis, and I respect the man. I would rather recommend you either vote for her or you vote for him. Now, let me
Okay,
finish.
Daniel, we got to wrap up.
Okay.
Yep.
Housing. The reason why so many people are getting displaced and the reason why so many people are homeless is because they don't have the deeds to the apartments that they're in. We are an excellent opportunity. Trump shut down the government. Section 8 owners aren't getting paid, but those people aren't getting evicted. Give those people the deeds to their apartments so they have something to build wealth and buy out the owners.
All right, I just wanted to, there were a few people who were mentioned there, and so Theo, before we get to you, I just want to give anyone who was mentioned in that by Daniel a chance to respond. Just
First
briefly,
of all,
just a brief response.
My name is Jimana, not this guy. Second of all, I was housing and buildings in the last term. I'm not housing and buildings now. And if you learn about city council, NYCHA is a separate committee. But what I am proud to do, when I'm going from community organized to housing and buildings, is where I got the bills passed with the three-quarter housing, is where I did the best that I could to fight those rezonings and MIH when the mayor put that failed policy in, but we didn't have the support of the leadership and it passed. I was one of 3 council members to vote against it because I knew then what everybody knows now, that it was failed. Housing has been my life for the past 20 years. I advise everyone to go look at where people are getting their money from in this race. The developers and Rebney are not supporting me, sir. I have been on the ground, on the streets, and in the halls of power, getting bills passed to fight the gentrification that's been happening and the displacement of people. I will continue to do that as your public advocate.
Thank you.
I usually don't respond to Twitter trolls, but there's been more than one Twitter troll up here taking shots at my rezoning. I represent East New York, and I did represent East New York, and I am proud of that decision. East New York, for those of you who've never been or never visited or understand what it's like to live in the community, it's a neighborhood that's majority market rate housing. What we're seeing in East New York is the price of rent going up because the price in Bed-Stuy and Bushwick has increased dramatically over the past 10 years. What we had to do is build real affordable housing. Did the mayor want to build MIH housing in my district? Yes. Did he get MIH? No, we got more than MIH. We got deeply affordable housing with increase for homeless families, with increase for lower income folks making between $18,000 a year to $60,000 a year, and $250 million for homeowners and all the other investments the neighborhood has been lacking for a very long time. So do your homework before you guys start trolling, and then we can start having a real conversation about what the East New York rezoning really looks like.
Okay, Daniel, I think we're fine.
10 years ago, when people lost all their property to the mortgage crisis, is exactly when the rent game went up. Give people the property instead of the government who owns NYCHA and can't keep it together. Give people the property. Give them upward mobility. Give them a chance at life. None of this nonsense. This is jargon. None of that. They're bringing it up when they're getting attacked, but they're not out there every day saying the developers are taking over the city, saying we're looking at a housing crisis. Give us the deeds.
Okay, thank you.
Wow. Well,
all right, our final minute up here, and then we're going out for questions.
Okay, 1 minute is very hard to answer that very question about homelessness and housing. And Grace, you're right, and on that question, because my wife just lost her job. She's a doctor, she's a psychiatrist, she made a mistake on HIPAA, she lost her job. Because I am in a rent control apartment, I'm still running. I'm still here we lost 2 income. We have a cushion. And I know that I did the calculation. Today, if I was, minimum wage would need to be $45 for me to live in my neighborhood. I pay $167 because we are in a third-party transfer building and we fought so many years with HPD, with the help of HPD, and I can tell you how bad HPD is. But anyway, back to homelessness, there is the other part. Becoming homeless, I was homeless. I made the decision one day that I couldn't afford my apartment and I slept at the university under the desk for a whole week. And you're right, there is something that goes in your head after a week. The police caught me, I was on the paper of the newspaper, and suddenly I became the roommate of someone else. I can tell you that homelessness is not one single track issue. You become homeless because you're old and you don't have enough saving, and you lost your boat, and suddenly your whole business is gone and you live in your car. You're homeless because you're schizophrenic. You don't know where to go. Yeah, we'll give you an apartment, but you need to have the support of the mental health system. Like when they're closing all those hospitals around, have you tried to go to a hospital and tell them, he needs help? Oh, no, the family will take care. We cannot take him in emergency. Yeah. Oh, the law doesn't allow it, so you cannot get it. Going through the system is so hard that's why I'm running, because I'm tired. And like David said, dealing with the politicians that don't listen to you and don't listen to your experience, and you go to them and you tell them, this is the experience I experienced. No, you don't know what you're talking about. This is generally the answer. So this time I got tired, I'm running, and I'll give you the rest of my answer on my website, theochino.com. At a later date, around February 20.
All right, so we do want to go out to the audience for questions, and I believe there is a question from someone from GMHC. I have one too. So we're going to start with a GMHC question, then there is someone from the new school with a question, and then we can open it up, and for these, we want to keep things very tight and moving along so we can hear from as many people.
Okay, so good evening, everyone. Thank you so much for taking your time and answering our questions. I'd like to thank our CEO, Kelsey, and Manny Rivera for helping put this together. So the question is coming from the Consumer Advisory Board. I'm the administrative coordinator there, and one of the consumers who were supposed to ask the question fell sick. So those are one of the sad realities that people with HIV and AIDS are living with today. So one of the questions were, the Denver Principles, which are the equivalent to the Bill of Rights for people living with HIV and AIDS, states that people living with HIV and AIDS should be involved in a decision that impact their lives, which includes but is not limited to membership of board of directors of HIV agencies and governmental entities that deal with HIV and AIDS policies. Do you support this, and what have you done to implement such in the past and propose to do in the future?
So we'll ask a sort of yes or no, do you support that idea of people living with HIV and AIDS being on the boards, having a voice in the organizations that they are using or are impacting their lives? And then secondly, a specific thing that you have done to support or advocate for people with HIV and AIDS. And we can, whoever wants to begin can jump in. You want to begin, speaker?
Yes, completely. You know, my philosophy of leadership is about inclusion, right, and participatory governance. I was one of the pioneering council members at the time when we did participatory budgeting, and I brought that concept of inclusion in decision making. Anybody that is impacted should have a say in the decisions that are being made with regards to programs that affect them, right? Communities have to have a say in conversations about decisions that are being made about their community. I am a deep believer in that, and that's been my style of governance also when I led the city council in talking with my colleagues. So yes, I believe that's the case. I've implemented those processes as a council speaker and as council member in my district, and I will continue to do that style of governance as a public advocate. As I advocate for issues, what I'm saying is I want to go into communities, and I want the communities to define for me what the agenda should be of the public advocate's office. This is your office. It belongs to you. So you have to define what our priorities should be and what the course of action should be that we should be advocating for.
Why don't I phrase it this way, too, just so we can hear from other people, but is anyone opposed to the idea of... Okay.
So one, we often create programs from youth to people with HIV without including them in what's going on. So 100% I agree. And I'm sorry I have to call out one of the sponsors, but I was in a meeting with some people in this room where GMHC was called out because they didn't have people with HIV and AIDS or enough on their board, and so we have to call them out as well. So that's an issue that I was in a meeting, we're discussing that, and that's one time that I was there, and I was very upset to hear about that. I love the work that GMHC does, but we have to do better in making sure that there are representatives and enough representatives of the population. But just really quickly, I want to say with homelessness, we can't keep lumping them all together. Mental health is an issue for a smallest percentage of homelessness, street homelessness. There are some people who are domestic violence survivors. There are some people who have HIV. And as was mentioned, the majority of people are working poor. So we have to make sure when we're talking about homelessness, we're talking about which population and what we're going to do.
Just to answer the question very quickly, I'll say yes, I do. But the problem of knowing who has HIV, it's a privacy problem. And so now, are we going to start ratting out someone to say, we need to have them on the board? They might be on the board, you don't know. And we need to talk about privacy, but that's for another issue. By the way, the public advocate is the chair of the Commission of Public Information and Communication, and they deal with privacy, but they never meet, so I will do that.
Yeah, real quick, I'm not sure if you're looking for a vote, them to have the right to vote on it. Is that what you're looking for?
Yeah, on
So being on boards.
representation in general.
We need the communities to step up and speak for themselves. I would want them to, I would cheerlead for them all day. Things that become mandatory, we need to understand, because the taxpayers are paying for it. And the taxpayers should have the right to vote on it. But as far as advocates go, they should be encouraged to be on boards and getting out agendas and raising money for whatever they want.
Yes, and I agree with Theo that we need to respect people's privacy.
Yes, we need to respect people's privacy, but I also have advocated for the Office of Public Advocate to be decentralized so that there's a deputized public advocate in every single neighborhood, because I don't know what's going on in East New York when I live in Astoria, and one public advocate at City Hall sure as heck probably doesn't know what's happening in every single neighborhood in this city. And every single neighborhood has their own constituency, has their own problems, and a deputized public advocate would be somebody who's trained to investigate, who's independent, who, a lot of people in New York don't trust their politicians or government or other officials. So it's a place where that person is a trusted member of that community who is trained to investigate what's happening on the ground in that community and to hold lawmakers accountable and community boards that are accountable that may or may not be fulfilling their obligations.
I believe in basic human dignity for everybody. And I believe that part of that is in any community, you need to be able to plot your own course, and you'll need to have people that are members of that community being the leaders of that community. So of course, I support people with HIV being on boards and the like.
I support representation and 100% support the representation of people with HIV being on the boards of the organizations and service agencies that serve people with HIV.
I've got it. Thanks. So, as mentioned before, I have 3 programs that I plan to run as public advocate. The entire basis of them is the idea that we need representation from communities in decision-making about decisions for their community. So, I strongly support this. I don't think that we should make people who are uncomfortable serving on boards serve on boards if that's how they feel, but to support the idea that folks who are the recipients of particular decision makings or of the programs which are being put to their community shouldn't be on a board that makes decisions about those communities is egregious. So I strongly support the idea of people who are in a community, who are stakeholders, who are affected by the issue, being engaged in that decision making.
Thank you. And I also have one more question.
I think we have a student from the new school who has a question.
Yes, thank you very much. Thank you to all the candidates for being here. Thank you to New York One, Center for New York City Affairs, GMHC, and the new school. My name is Tully Hudson. I am a PhD student at the Milano School for Policy Management Environment. Earlier, some of you touched on rent regulations, but as a public advocate, as the city ombudsman, what would you do to ensure that city agencies protect city tenants from landlords who raise rents egregiously, harass tenants, and use other techniques to force tenants out of their homes? And to clarify, I don't mean a public shaming list of worst landlords, but rather you holding city agencies like the Department of Buildings and HPD accountable to protect New Yorkers under existing law. Thank you very much.
Yes.
Sure.
You want me to start?
Well, we can start here. You can begin, Ben.
All right, thanks. So this is exactly what a program like Civics for All is designed to do. One of the major issues with tenant harassment and the lack of preservation of affordable housing is that people don't know their rights. Tenants don't know their rights. And so going out and ensuring first that people understand how the affordable and rent regulation system works is absolutely critical to ensure that tenants know what their rights are. That is then how you identify people who have problems and can begin to solve them. To say that there's a blanket solution, there's legislation which can be passed. And I think there are some important legislative things that we can do. And a program like Power for Communities would be there to bring stakeholders to the table, to encourage folks to understand the system and then to activate on it and reach out to their elected officials and to build power across the city and political leverage and will to pass that legislation. But ultimately, when people have problems with their landlords, that is something that needs to be found out and then addressed through legal remediation and legal action, and then through helping people and stewarding them through our bureaucracy. Because it's been said before, it's very hard, it's complicated, it's not made easy. We need to make it easier, we need to strengthen our laws, but the public advocate needs to have folks who are out there engaging people, not just as listening, not just listening. Politicians always have people who are listening and taking things back to the office. We need people who are trained in the bureaucracy and civics and governmental structure of the city to teach that to other people, to empower them to solve their own problems, and to work as problem solvers with them.
So we're running short on time, so we want to make sure everyone gets heard who wants to be heard, but let's keep it short and tight.
Sure, short and tight. The public, you mentioned existing laws that protect tenants. A lot of those tenants call into the city using 311. We don't have that information out in the public about when a tenant is complaining about a landlord and their adherence to existing laws. That information is going to the city. So that is a source of data that the public advocate, one, can follow up on. We can ask for it nicely, or two, we can follow up with litigation. Ben mentioned litigation. I think I am possibly the only lawyer. No, almost. No. Okay, we have two other lawyers. But being a lawyer, I think, is an important criteria for this job, just for that situation when, you know, you're asking for information that's an important part of the public advocate's job, and the city agencies aren't giving it. I've talked the least out of anybody up here, so I appreciate you. Thank you.
I just want to say that I can guarantee you I'm the only plumber in this room. And I can guarantee you, after I leave here, I'm going to Bensonhurst. A bakery got shut down. They turned off the gas from a little leak. He's out of business, and he has to get it done right away. I can tell you that my job every single day in homeless shelters that are being built non-union, by the way, all over the city, I'm getting the heat going. I'm doing it. The agencies that they're saying that they need to rely on, the Department of Buildings, HPD, Con Ed, they're just getting in our way from getting the job done. Other thing I want to say is we spend $50 billion a year on natural gas. We're completely addicted to natural gas, and we're just fracking addicted, and we need to end it.
I am one of the lawyers here, and I just want to say one thing. I am very confident that I know more about the rent stabilization code than anybody on this stage. I'm very confident I know more about housing law than anybody on this stage. So as far as specific things, there's something called the Tenant Protection Unit from DHCR, and what they do is they go through the rent registration records and they see irregularities, and they're able to go after landlords. If you were to give me a rent registration, I could tell you in a couple of seconds where the irregularities are. And as public advocate, I'm gonna make sure that the Tenant Protection Unit is doing their job so that people are not being forced out of rent-stabilized housing.
Let me you don't know the most about rent regulation.
I absolutely do.
But it's okay.
Absolutely do.
As a tenant organizer.
Absolutely, I know more about the law than you.
Guys, it's not a debate, it's a forum. So
that is just not true. As a tenant organizer, I had to learn about the law to protect my tenants. But I want to say something. First, we have to make sure we have a public advocate who will hold everyone accountable. So some people will hold the mayor accountable because they feel safe. Some people will hold the governor accountable because they feel safe. Most people won't hold their own leadership in their house that they're legislating safe because they feel safe. I don't have that problem. I call the mayor, the speaker, the governor out when it's needed, and that's what we need in a public advocate. And what I want to say about rent regulation, it's critically important that it's not just a price point, it's protections that are provided by rent regulation that prevents people from being evicted, and that's critically important. The TPU is important, but it wouldn't need to be there the way it is if the governor hadn't failed on rent regulation. And so whether it is the bills that I got passed in the city council to deal exactly with what you're talking about, with tenant harassment, or whether it's Google, Jimana Williams, the Rent Guidelines Board before I was elected, first time ever shutting down the Rent Guidelines Board, or as a councilman getting arrested at the doorstep of the governor to deal with rent regulations. But the problem is when we pass these laws, these landlords find other ways to get around it. I'm hoping very soon that landlords begin to lose their buildings and or go to jail. When that happens, I guarantee you there'll be changes in behavior across the city. I also have a bill that will make you have to have a license before you can be a landlord and a property owner in the city.
I just wanted to say to Jared, actually, because I agree with Jumani. I'm a tenant activist as well, and no, DHCR cannot look for pattern into the complaint.
If you give me a rent registration right now, I'll show you where the irregularities are. I'll show you where the fraud is. It's very easy to figure it out. Rent stabilization is a very technical system. And a lot of things I'm hearing here are just beyond the law.
There are people lined up to ask questions. I just want to make sure.
So I just want to...
Let this man speak, please. Y'all debating back and forth. Let the man speak.
Well, can I finish answering the first...
No. Y'all answered enough. No.
Okay.
Wait. We're the candidates, so become a candidate, actually.
I call you. Don't you do that. Don't you do that.
Let's, Theo, let's hear from some of the people who've lined up to ask questions. And yes, we are going to limit, these are going to be incredibly brief, like give your 10-second, your 30-second at most elevator pitch in response to these. Yes. And if anyone has, in order to make sure that we get to as many questions as possible, if you want to direct your question to anyone specifically up here or two people, that will also help.
I mean, I've got cards. Y'all can come see me after this and give me your answer yourself. But, okay, so, hi, my name is Zach Borodkin. I work at Disability Rights New York. Thank you. So my question for all of you is, we've seen a lot of representation of how these issues, whether it's housing or drugs, affect communities. Where is the disability community in this conversation? Because we are a demographic that has not only made an effect, but we're growing, and we need to be included, whether it's representation or in conversations about what we can do, or rather what you're going to do to help alleviate the problem among the disability community.
Let's start in the middle, and Nomiki can start. And again, it's not a reflection of the importance of the question, but we're going to keep our answers very tight so we can try and get to some more questions.
Thank you, Zach, for your question, for waiting. This is the largest voting bloc in America, the disability community. And it's absolutely absurd that the priorities and rights of the disability community and the activists who've been involved and put their bodies on the line, as this weekend at the Women's March, being at the disability rights event at Grand Central Station, seeing folks turn out, put their bodies on the line just to get attention from lawmakers is absurd in 2019. The biggest offenders of not paying attention to the rights of the disability community are landlords, are the developers. They're the ones who have bought up our lawmakers from not only making sure that your rights are represented first and foremost, but that they're even abiding by existing laws. So number one, I think the public advocate should be investigating any of these landlords, to go back to the initial question about housing and disability rights, but furthermore, making sure that your priorities are on the table first and foremost on day one, and I only have.
We can pass the mic.
I would like to revamp the Public Advocate's Office to actually have public advocates who are advocates, like the Public Advocate for Disabilities. Number two, we have to make sure that the human rights law, it's one of the most underused laws in New York City. It forces, for example, a landlord, if somebody becomes disabled or is disabled, to revamp the entire bathroom so that they can get access. A lot of people who are disabled don't know they have that right by New York City law. And that's just not a coincidence. That's a sin of omission on the part of many of our electeds and our previous public advocates who haven't been alerting the people to this fact. Secondly, many people with disabilities have to book a car through the city a day in advance. You guys can't be spontaneous, right, through the rideshare program with New York City. That's got to change.
All right, briefly. Ben, let's go to you.
Of course I support disabled people, and I actually had somebody reach out to my website. He was from Long Island, though. He was like, I am getting surgery after surgery, and I'm getting no housing, and I looked into it a little bit, and it's very difficult. I don't know what to do, but I know that there's an issue, and I'd be down to help.
Well, Zach, just before, I want to answer you 5 seconds. Jared's solution, I want that to happen and change the law so the HER has the power to look for those inconsistencies that he's talking about. For Zach, actually make the system for you to run and to become a candidate much easier than what it is for all of us to be here. Because right now we lost Ifeoma Ike on a simple little paper. She was supposed to be with her. She didn't file that little paper, she wasn't here. So we need to make it easier for you to have a bigger voice. Also, to look at those walk-up bathrooms that they build on the 3rd floor, and they get the discount for building an ADA apartment on a 3rd floor walk-up. That's a problem to me. So there is much more, but I don't have time.
Okay, we'll jump down to Ben and then go back to the middle.
Awesome. So ultimately, the reason I've invested in working on these programs is because it provides a framework for thinking about how to incorporate new ideas and new constituencies into the decision-making process of New York. A program like Power for Communities allows for longer-term planning based on the community, which allows us to bring in different stakeholders which are currently overridden by special interests in the city government. So these are the programs and a framework for building power for people who aren't currently heard. That's why we need to get Civics for All out there so people know what their rights are, know how to access the system. Power for Communities to bring new folks to the table and make sure there's time for them to be heard. And then third, all right.
Let's pass the mic.
BenjaminYee.com has all the programs. Please check them out.
I'm proud to thank you for the question. I'm proud to have the 504 Democrats endorsement, and it's the premier organization working to lift the disability community's voices. You are raising a very good issue. No one has set-asides. We have set-asides for homeless and other things, but there's no set-asides for disabilities. We might need to start that. And 2, I think all of us have failed, and me included, and the elected officials have failed in addressing this issue. So I apologize. As public advocate, I will do so much better to make sure that we lift the voices of disabled New Yorkers when we're making these decisions.
As the Public Advocate's Office has a unique and special role in making sure to serve the disability community, given its mandate to make sure that it's monitoring how well the city provides services to all New Yorkers. And I think that has particular meaning for the disability community. I have publicly stated that I would hire a staff member, again, with representation of someone of disabilities to review all of the services that are coming out of the city to make sure that we are raising up and identifying any problems, and also make sure that my office is acting in accordance and supporting the community as much as possible.
I said it before, Zach, and I mean it, and I'll keep coming back to it. We begin with the premise that everyone deserves basic human dignity. And we're going to end with the conclusion that everyone's going to get basic human dignity. Now, for a specific thing that I would do for you, the human rights law in New York City, it's good, but it's its own little commission, and a lot of times a complaint is filed, and it sort of hangs out on a desk, and nothing happens with it. And what I would like is for that to be able to be a private cause of action in court, so there's something to actually be done with that.
So I think back to what question that was asked earlier about people being able to sit on boards or having a say, right? Communities that decisions are being made, right? We run the city of New York. We're in the city of New York. We have to make sure that it is serving the needs of the disability, those who are disabled in the city of New York. So it's important that we have that voice. We passed a law in the city council that ensures that in every city agency there is supposed to be someone that is designated to be a liaison, right? Someone who is dealing with issues that impact the disability community in every agency. Figure out how that agency is responding to the needs of the communities, the diverse disability community. And That's not happening. I'm sure it's not happening. One of the things that the public advocate can do is, if it's brought to their attention, right, is to monitor laws that have been enacted in the city of New York and which city agencies are not honoring, right, and not respecting the letter of the law, is to take a look at that, investigate it, and make the recommendations on how to resolve it. And I think this is one area where definitely we could do that.
Thank you.
All right, we have a late arrival to the forum. We want to bring Assemblywoman Latrice Walker up on stage, who's coming to us from Albany. She is the Assemblywoman from Brooklyn, from Brownsville. If you want to grab a seat here on the end. But before we conclude for the night, I just wanted to ask you a question that was asked to everybody at the beginning about the HIV/AIDS epidemic in New York City. And so in 2017, new infections were at a record low, but this is an epidemic that is disproportionately affecting men of color, women of color. And so the question put to everybody up here is, what would you specifically as public advocate do to drive that number down even lower and to do outreach and work with those communities most affected?
Thank you, and that's a great question, because the district that I represent, Brownsville, actually has the highest cases of the highest number of new cases of HIV and AIDS. And we've done a couple of things. Just last week, we just passed gender and also a ban on conversion therapy in order to deal with discrimination in housing and employment. But we recognize that this discrimination happens all the time. So a couple of things that I've done. When Brookdale Hospital was losing some of its resources, it has a TLC unit. We fought to make sure that this unit stayed viable to be able to service this very vulnerable community. We did that, we won. We also built a number of housing units that are specifically for people who are living with HIV and AIDS. The Hegeman, which is over on Hegeman and Thomas Boylan. And right now we have a new development that's coming with the African American Planning Commission. That's going to be located on Livonia Avenue. So we want to make sure that we're providing safe and secure housing for people so that they're not having to deal with the expenses of their drugs and taking care of whatever their health care needs are, juxtaposed to being able to pay rent. Another one of the things that I've done is I used to intern at this place called ARCS. It was AIDS-related community services. And I remember each and every day that we could make these dolls, and I put an L on my doll's chest. And people were asking me if it was because I was naming my doll Latrice. And I said, no, it's because I was lucky. And that was the only thing that stood between the difference between me and the people that we were there servicing. So at the end of the day, for me, it's the same experiences that everyone else experiences that we fought for. It's the same thing that everyone needs to be fought for, even if you're living through a diagnosis of HIV and or AIDS. And that's what I've done throughout my entire career. And that's what I'm committed to continuing to do as your next New York City public advocate. I am Assemblywoman Latrice Walker, and I know I was hearing some questions too about housing, and I think I'm a tenant also, and I grew up in public housing as well, and a single mom. And to the question about disability, living with my mom or living through my mom's circumstances, my mom was a very strong and robust woman. When she was raising me. But she grew into a disability, so I recognize also that even though we may be able-bodied at this moment, we're all susceptible to, I'm not sure where he is anymore, susceptible to having to live throughout that lifestyle. So I'll just add my own personal experiences, my expertise, both as an attorney and just a lifelong resident of New York City, to making sure to fight on behalf of all of the residents of New York City.
Thank you. And that is, unfortunately, we are at 8 o'clock on the nose. We are going to end tonight's program. I believe some of the candidates may be able to stick around if people want to talk to them. They all have websites. They have information online. Thank you all for being here and taking part in this conversation.